name is Bernice and I'm going to be your nurse today. How are you doing today, sir?
Well, I feel better.
You're feeling better?
Yeah, but
that's great.
The doctor said I have diabetes, and they said I need to take care of my feet. But can you teach me how to take care of my feet?
Yes, I could definitely teach you how to take care of your feet.
Okay, good.
You know, there's some risk and factors that we need to go over with, and one of them is your weight, sir.
Yeah, I know I'm overweight.
Okay, some way that we could change that is your eating habits. We need to eat more fruit. We need to eat more vegetables, more lean meats like chicken, fish. You think you could do that?
Those cheeseburgers. No more cheeseburgers?
You know, we could have one once in a while, but you need to make sure you take care of your glucose, okay?
Okay.
Another thing that we need to emphasize is on your exercise. Do you ever exercise?
Well, I don't have time.
You don't have time? Well, you know, some things that we could do is instead of using the elevator, we could go up the stairs. You know, try to take a walk, 15 minutes, and try to build your resistance on walking. And then, or walk 3 times a week. Do you think you could do that, sir?
I think so.
This is, walking will increase your circulation. And we also need to take care of your diabetes by checking your glucose with your glucometer.
Yep.
And also by your medication administration, which is your insulin. We need to make sure we inject your you inject your medication, and I know that they already went over with you, and you did really good. Okay, so we need to keep that up, sir. Now, when you have good circulation, that helps you prevent injuries. Okay, so we're gonna go over injuries prevention. What we need to do is when you shower every day, we're gonna make sure that we take a look at your feet. Okay, we're always gonna look at your feet. We're gonna start from the bottom up. Okay, we need to make sure that we check the bottom of your feet. If you can't see, do you think you could see the bottom of your feet?
Well, I haven't seen the bottom of my feet in years.
Okay, then what we could do is that we could use a mirror. Use a mirror and look at the bottom of the feet. It's very important.
Well, that's a great idea.
It is a great idea because if you make sure that you don't have any wounds at the bottom of your feet, it prevents infection. And when you prevent infection, it prevents necrosis, gangrene. And if you prevent gangrene, then that prevents amputation.
Oh, man. This is serious stuff, huh?
It is serious stuff because that means that if you have any unhealed wound and it's not taken care of, then that could cause any amputation. And we need those legs to get around.
Yeah, I like my legs. I don't want them to cut off.
Okay, and whenever you have an unhealed wound, we need to make sure that we call our physician so they could take a look at your wound that is not healing, okay? Any cuts, any swellings that don't heal need to be assessed by the physician, okay?
Yes, ma'am.
And how about your water heater? What temperature do you have your water heater?
Well, I don't know, but what does that have anything to do with this?
Okay, well, you know, sometimes when diabetes patients, sometimes what happens is that they have neuropathy. Do you know what neuropathy is?
No. Okay,
neuropathy means when your nerve endings don't work because of the diabetes, and this causes for you to feel any cold or hot weather.
For me to feel it or not feel it?
For you, they not feel it.
Oh,
so sometimes you could have
see.
hot water, and if you have hot water, then you could burn it. If you can't feel it, then you're just gonna shower, and it could burn your skin, and this could cause serious injuries to your body. So we need to make sure that water heater is at 120 degrees, okay?
All right.
Okay, another thing that we need to I'm going to explain to you some do's and some don'ts, all right?
Okay.
The do's we want to do, the don'ts we don't want to do, okay?
Okay.
Okay.
Give it to me.
Okay, we're going to wash your feet every day, okay? Every day we're going to wash them, and we're going to make sure that we dry them. And we're going to make sure we dry in between our toes, sir, okay? We're going to wear shoes at all time. Do you wear shoes inside your house?
Well, not when I'm inside the house.
We need to make sure you wear shoes inside because what if there's a glass at the floor and you don't know, then you could cut yourself. and that could cause infection. And with your diabetes, it's gonna be harder to heal.
Okay.
Okay? And we're gonna buy shoes that are comfortable. No boots. Nothing that's tight. Do you wear boots, sir?
Well, yeah, where I work out in the field in the sun, I gotta wear some boots that, so I don't smash my feet.
And have you ever seen any cuts on your feet? They're always hurting?
Well, I don't know. Yes.
Okay, we need to make sure that we wear more comfortable shoes, okay?
I sometimes I get ingrown nails. Is that because of my shoes? They're too tight.
Yes.
Oh, okay.
So we need to make sure that they're comfortable. You're gonna wear. Does that happen?
Yeah.
We need to make sure that we need to make sure that. We need to make sure that we wear this.
Okay, I got it.
Okay.
Mhm.
To prevent ingrown nails, because ingrown nails causes infection, and we already went over that. Infection causes gangrene, and gangrene goes into
They'll chop your foot off.
They'll chop your foot off.
Okay.
We need to prevent that. Okay. Another thing, something that you should not do. These things you do not do.
Okay.
Okay. We make sure we don't walk on hot surfaces. So all the time, wear shoes. Never go outside without shoes, because sometimes the floor is hot. Okay? And wear shoes without stockings. We always wear stockings. In Walmart, they sell some great socks, and they're actually for diabetics. It's going to help your feet, and it's going to be more comfortable. And we need to make sure that your feet are always dry. Soak feet. We don't do that. We always dry them, okay?
Do not soak in hot water.
Do not soak in hot water, okay? Never.
Oh, okay.
Okay.
All right.
Okay, so then now, okay, so now demonstrate me. What are you going to do to increase your circulation, sir?
Well, I think you said I need to lose some weight.
Mm-hmm.
I need to start eating right. And I need to monitor my diabetes.
Yes. Okay, tell me 3 things that's gonna help you prevent any injury, any harm to your feet.
I'm gonna check my water heater.
Mm-hmm.
And
Look at the bottom of your feet.
oh yeah, I'm gonna check the bottom of my feet every day with the mirror, and I'm gonna talk to my doctor.
Yes, you're gonna talk to your
and
doctor.
I'm gonna see him every month.
Yes. Okay, now tell me 2 things that you should not do.
Never soak your feet in hot water, and don't wear tight shoes. Right?
Yes, exactly. Very good, sir. Well, I think we're all set. And do you have any other questions about your feet? On how to take care of your feet, sir?
Not right now. Thank you, Miss. You were real kind.
You're welcome. Have a good day, okay?
You too.
Your call button is right here, so if you need anything, make sure to call me, okay?
Okay.
Have a good day.
Bye.